Nasopharyngeal cancer is a rare type of head and neck cancer that originates in the nasopharynx, the upper part of the throat located behind the nose. This area connects the back of the nose to the top of the throat. Nasopharyngeal cancer (NPC) is different from other cancers of the head and neck in terms of its location, symptoms, and risk factors. Key features: location. The nasopharynx is located behind the nasal cavity and above the soft palate of the mouth. Tumors that develop here are known as nasopharyngeal carcinomas. Common type. The most common type of nasopharyngeal cancer is nasopharyngeal carcinoma, which typically originates in the epithelial cells that line the nasopharynx. Symptoms. The symptoms of nasopharyngeal cancer often resemble those of other less serious conditions, making it challenging to diagnose in the early stages. Common signs and symptoms include nasal symptoms, nosebleeds, frequent, unexplained nosebleeds, nasal congestion, persistent blockage or stuffiness, often in one nostril, postnasal drip, the sensation of mucus drainage in the back of the throat. Ear symptoms, hearing loss, hearing issues, often in one ear, particularly if the tumor obstructs the eustachian tube. Tinnitus, ringing or buzzing in the ears. Ear fullness, a sensation of fullness or pressure in the ear. Neck symptoms, lump in the neck, swelling or lump in the neck caused by swollen lymph nodes, often the first noticeable symptom as the cancer spreads to lymph nodes early. Throat symptoms, sore throat, persistent discomfort or pain in the throat, difficulty breathing or speaking, difficulty breathing or changes in the voice due to tumor growth. Facial symptoms, facial pain or numbness, particularly in the cheeks or jaw, if the tumor affects nearby nerves. Headaches, persistent or severe headaches. Causes and risk factors. Nasopharyngeal cancer is relatively rare in most parts of the world but is more common in certain regions, such as Southeast Asia, southern China, and parts of North Africa. Risk factors for nasopharyngeal cancer include Epstein-Barr virus (EBV) infection. EBV, the virus responsible for infectious mononucleosis mono, has been strongly linked to nasopharyngeal cancer. Most people infected with EBV do not develop cancer, but it plays a key role in the development of NPC, especially in endemic regions. Genetic factors. People with a family history of nasopharyngeal cancer may have a higher risk, particularly in certain ethnic groups like Southern Chinese. Diet. Diets high in salt-cured fish and meats, which contain carcinogenic nitrosamines, are associated with a higher risk of NPC. This is more common in regions where such foods are staples. Tobacco and alcohol. While smoking and heavy alcohol consumption are major risk factors for other head and neck cancers, their role in nasopharyngeal cancer is less clear but likely still contributory. Environmental factors. Exposure to certain chemicals, including wood dust and formaldehyde, may increase the risk. Diagnosis. Early diagnosis of nasopharyngeal cancer can be challenging because its symptoms can mimic those of more common illnesses. To confirm the diagnosis, several steps are taken. Physical examination. The doctor will check for lumps in the neck or abnormalities in the nose and throat. Nasopharyngoscopy. A thin, flexible tube with a camera endoscope is inserted through the nose to examine the nasopharynx for abnormal growths. Biopsy. If a tumor is found, a tissue sample is taken and examined under a microscope to determine if it is cancerous. Imaging tests. CT scan or MRI, used to assess the size of the tumor and whether it has spread to nearby tissues, bones, or lymph nodes. PET scan, can help determine if the cancer has spread to other parts of the body. EBV blood test. Blood tests for elevated levels of antibodies against EBV can support the diagnosis, especially in regions where NPC is common. Staging. The stage of nasopharyngeal cancer is determined based on the size of the tumor, its spread to nearby tissues and lymph nodes, and whether it has metastasized spread to other parts of the body. Staging ranges from stage I early, localized cancer to stage IV advanced cancer that has spread. Treatment for nasopharyngeal cancer depends on its stage, the patient's overall health, and the specific characteristics of the cancer. The main treatment options include radiation therapy. Primary treatment. Radiotherapy is the primary treatment for nasopharyngeal cancer, especially for early-stage disease. It is often used in combination with chemotherapy for more advanced cases. Intensity-modulated radiation therapy (IMRT). This advanced form of radiation therapy delivers precise doses of radiation to minimize damage to surrounding healthy tissues. Chemotherapy. Concurrent chemoradiation. Chemotherapy combined with radiation is the standard treatment for advanced nasopharyngeal cancer. Common chemotherapy drugs include cisplatin and 5-fluorouracil. Neoadjuvant pre-radiation or adjuvant post-radiation chemotherapy, used to shrink tumors before radiation or to kill any remaining cancer cells after radiation. Surgery. Surgery is less common in nasopharyngeal cancer due to the difficulty of accessing the nasopharynx. It may be considered in certain cases, especially for recurrent cancer after radiation. Targeted therapy. For some patients, targeted therapies such as cetuximab, which blocks the protein that cancer cells need to grow, may be used, particularly if the cancer has spread or does not respond to other treatments. Immunotherapy. Newer treatments like immunotherapy, which help the body's immune system recognize and fight cancer cells, are being explored for advanced nasopharyngeal cancer. Drugs like nivolumab or pembrolizumab may be considered in cases where the cancer has spread or recurred. Prognosis. The prognosis for nasopharyngeal cancer depends on several factors, including the stage at diagnosis and how well the cancer responds to treatment. Early-stage nasopharyngeal cancer has a higher survival rate compared to advanced stages. 5-year survival rates. These range from 70 to 90% for early-stage cancers but drop significantly for cancers diagnosed at later stages or those that have metastasized. Prevention of nasopharyngeal cancer focuses on reducing risk factors. Avoiding salt-cured foods, limiting the consumption of preserved foods high in nitrosamines, particularly in high-risk areas. Vaccination and control of EBV. Although there is no vaccine for EBV, awareness of its role in NTC can be a preventive strategy in high-risk populations. Tobacco and alcohol avoidance. Although less directly linked to NTC than other head and neck cancers, avoiding smoking and heavy drinking can reduce general cancer risk. Conclusion. Nasopharyngeal cancer is a rare but serious disease, particularly prevalent in certain regions. Early detection can be challenging due to its non-specific symptoms, but with advances in treatment, including radiation, chemotherapy, and newer immunotherapies, survival rates have improved. Timely medical attention and a multidisciplinary approach are critical for managing this cancer effectively. If you have more specific questions or would like to know more about certain aspects of nasopharyngeal cancer, feel free to ask.